Thanks for getting on, Brooke. We know your time is valuable. So again, yeah, congrats on this podium, and it was Bulgaria, right? Is that right?
Yeah,
Thanks for getting on, Brooke. We know your time is valuable.
we actually went back to back, Bulgaria, and then in Poland we got another third. So, yep.
Wow.
Oh wow!
That's tremendous.
Yeah.
Can you tell us a little bit about this of the tour that you're on then with this new partner of yours?
Yep. So basically in the beach volleyball world, there's two different tours. There's the domestic tour, which is the AVP tour, and then there's the international tour, which is the FIVB tour. So what we've been playing over in Europe and really South America all over is the FIVB tour, the international tour. So we're playing against teams from lots of different countries, battling it out against them. And then now we've kind of shifted to the domestic tour, and we'll be playing some in Denver and Manhattan Beach, and that's the AVP. So we kind of bounce back and forth depending on the schedule. But the ones over there in Europe where we got the bronze was the international tour.
Oh, that's excellent. I did also read a little bit background on Kennedy. So it must be really fun for you in this part of your career to mentor somebody her age. She's going to be at USC, right, or next year?
Yep, she goes in the fall to USC, so she'll be a freshman in the fall. I didn't see this coming about. I didn't know what this part of my career was going to look like coming back from these knee surgeries and whatnot. So I'm pleasantly surprised with how it's gone so far. Someone with zero experience on the world tour and really no experience outside of the junior beach volleyball world. She's stepped up and she's learned so much and just has gotten better and better. And for me, it's kind of, everything is so new to her, on the world tour and everything, she knows nothing. So everything is so new. So she's so excited about everything. And that just kind of helps me see the joy and all of those things again, because I've been doing it for so long, it just comes redundant, so now to actually be there and it is really cool to be doing what we're doing, and sometimes we lose that focus after we've done it for so long. So I've kind of got that back as I've been playing with her, and just really enjoying every moment on the sand right now.
Yeah, from us, those of us who aren't professional athletes, we watch the sports and we like to try and experience, this thrill of winning, but obviously there's so much more to it. When I take care of patients and they have one surgery, I know it takes so much effort to come back from one, and you've obviously come back from multiple. What is it that, in your heart of hearts, what is some of the things that make you tick and just give you that strength to kind of push through?
Well, I think I'm stubborn in all areas of my life. And I think that plays a big role in coming back. I want to be as good as I can be as healthy as I can be. And I can just push myself, as hard as I need to go, because this is what I want. This is what, my goal is. And really, it's really important to have such a strong team around you. And, the more surgeries I've had, the more I figure that out.
Right.
And luckily I've had a great team around me for all of them, but it's just so important. And I have a great support from my family back home, because it is a lot. It's mentally draining. It's physically draining. Trying to get back into jumping after doing, having knee surgeries, physically it's hard. Mentally, I think it's harder. So there's all these different barriers you kind of have to break down. And I'm stubborn, I'm disciplined, and I've just kind of been like that all my life. So, once I have something in front of me, I'm going to get it done.
Well, it's very exciting to see the progress. And, I know obviously we originally met through Chad Boucham with Repair Sports out here. And then I've talked to your physical therapist out there, and you found a really good team out there in Florida. Just overall, because we've done procedures on both your knees. We had texted a little bit before your Huntington Beach tournament. How are your knees feeling functionally overall now?
I can't believe I've had 7 knee surgeries. Like, this is the best my knees have ever felt. From middle school till now, my
Hmm.
knees feel so good. I'm jumping, I'm doing stuff in the gym that I haven't been able to do, jumping indoor, and I'm like, seriously, I don't know how, like this is happening, but like I'm going to PT and everything and stuff that, used to hurt, used to bother me. I'm honestly feeling great. I'm 38 now. I'm not like, some young beach volleyball player that's just starting out and all that. Like, my body has been through a lot. And honestly, I just can't believe how my knees are holding up.
That sounds terrific. I know athletes can just push, your pain level or ability to go through pain is much at a higher level. But like after you train or the day after, you're not necessarily paying for it with significant swelling or stiffness. The recovery seems to be responding. Would you describe it like that?
Yeah, exactly. I've had 0 swelling, 0 stiffness. My PT is actually kind of amazed because he doesn't know why I don't have the swelling and stiffness like he would expect. So I'm very thankful for that. But yeah, I'm pushing myself like as hard as I can right now. And like the next day, doing it again. I can push myself day after day. Recovery day there in the middle of the week, but overall feeling great day after day.
So how many days a week, or like just briefly, like how many hours are you in the sand every day, or how many days a week type thing roughly?
So right now we do about 2.5 hours in the sand every day. And then I'm in the gym. We're in season right now, so I'm in the gym 3 times a week with my strength coach. And then I still do my physical therapy. I'm doing that every day. Obviously, just when we're home, we're not on the road traveling. I see my physical therapist every day just to keep up on all the little things. I think that's also played a role in why I'm feeling so great. I'm just like every day I'm doing something to make sure that, we're not going backwards or anything. So we're
Right.
doing a lot. Yeah.
That sounds awesome. You gotta obviously dot a lot of I's and cross the T's. Keep your body ready to go. Um, I'm going to take us back to, I know when we first met, it was in 2020, and you had some knee. I was trying to look at your chart to refresh my memory. I know you had a few surgeries on both knees, maybe a number of years before, right?
I had 2 surgeries on my left knee before I saw you,
Okay, but none on the right.
none on the right.
Okay. And then you obviously had an acute injury
Mhm.
that you came to us for. And um, do you remember some of the conversations before, or how you went about deciding to move forward with subchondral? Do you remember some of your thoughts at the time? I know we had some conference calls and things like that.
Yep. So like you said, we met through my therapist, Chad. And he's someone I had been with at that time for about 6 or 7 years out in California. So when I hurt my knee, it was actually jump serving. I landed and just felt something. I knew it wasn't right. Got on the phone with Chad. He actually came to Florida where I was training at the time and checked it out. Thought it was meniscus. Ended up getting MRIs and stuff. It wasn't that. Um, and talked to Chad again, and he's like, "You don't know how lucky you are." Dr. D is in my office, and he just came up with something for this exact injury. He's like, "There's
Hmm.
nothing else like that you can do. This is it. This is what you have to do." I was like, basically that was it. Like, I trusted Chad. I'd been with him for so long. We did a little bit of research on what you were doing in the S Corps, and we just knew that was the best route for me. It was in the middle of, like, the Olympics were supposed to happen in 2020, and because of COVID, got pushed back to 2021. So thankfully, I was able to do the surgery with the Olympics pushed back. But yeah, it was basically just Chad introducing me to you, getting your thoughts on it, seeing what the other options were, and that there weren't a lot of great results from that, and we didn't know what kind of results I would have from it. So the best option was clearly to just do the S-core and see how that went.
What was your post-op recovery and that initial rehab like?
Oh, we're going back.
It's pretty cool. Yeah, you've
been through a few since then. Honestly, I can't remember.
Right.
Yeah.
Well, you were obviously able to get back to some high-level activity for the Olympic trials. I want to say you were on the sand maybe around 5 or 6 months.
Yeah, that sounds right. Because I think surgery was it in June, maybe? June of 2020. Yeah, so I was back on the sand and jumping. That's right. Before the end of the year.
Right.
And then getting geared up for the Olympics, which would have been July 2021. Unfortunately, didn't end up making that one, but that was the timeline. Get back on the sand within 4 to 5 months, and then the new year in January be like kind of ready to go to start prepping for the Olympics. So it was kind of a smooth process. Not a lot of hiccups for me with that one. Just kind of moved right along. Felt really good coming back from it too. And I think it's maybe kind of normal for a lot of people with what I've been through, like coming back and when the weather's cold and my body like just does not react great to that. So I was kind of worried because I was out in Tahoe training in January.
Okay.
So it was
That's
cooler.
Right.
I wasn't sure how I was going to respond. But yeah, I remember being surprised that my knees felt that great so quickly after a surgery like that.
Excellent. And then the following year, then as I recall, your left knee, the opposite knee started bothering you more, right?
Yeah, I think the end of 2021.
Yeah.
My left knee.
Yeah.
Yep.
And then that more or less became sort of the limiting factor.
Yeah, that was, I could not go on with how it was. I knew something was going on in there that I just could not push through anymore. And that's when I think I saw you again.
Right. And so for Neo and some of our other crew here, I recall vividly seeing some new MRIs on Brooke's left knee, and there was significant bone edema and subchondral involvement in her trochlea, which is her part of her patellofemoral joint. Because you've had a history of we call it anterior knee pain or sort of patellar tendon kneecap pain, right? That was basically where the pain was.
Yep,
right?
And that was like my first 2 surgeries long ago. Was my patella tendon and
what's
stuff.
her patellar tendon? So obviously, the patellar tendon and the patella are obviously very important with any jumping, landing sport. There's just tremendous pressure on this kneecap, and she was just jamming that kneecap into the trochlea, the trough where it sits, and just causing significant damage. So, we were seeing, when we treat these, we call these osteochondral defects. They're like little potholes in your knee. And when we treat them, the bone is often ignored. That's why the S-core is designed to address the bone failure to basically reinforce it and fix the fracture, the fractures that happen there. And then we also deliver it with a graft to seal in the blood products and seal out the synovial fluid. But traditional procedures do even less well in the patellofemoral joint, the kneecap joint, and we still call that joint patellofemoral syndrome. Anything that's called a syndrome in medicine is still kind of like a controversial area. So, anyway, so then we did that surgery on the left knee. I know we popped in to look a little bit on the right, and then you were able to recover from that. You had some other events, obviously, but the kneecap, we ended up doing patellofemoral joint surgery on both knees, actually. So on the left, and then she was also having osteochondral disease on the trochlea on her right knee. And so we also decided to fix that. And I think they're performing well because obviously the jumping landing that's where all that's happening. So yeah, so she's had she had some other repeat surgeries for injuries in different areas of her knee, and I do want to just thank you for keeping your faith in us to get
Oh, yeah.
to patch you up, because she kept sort of retweaking the knee in a couple different areas, and but knock on wood, I feel like we're obviously on track right now. Do you have any thoughts for what you might say to some other athletes or weekend warriors that just want to be active, that regarding your experience or sort of some advice?
Yeah, absolutely. First of all, Dr. D, amazing person, amazing doctor. I've seen a lot of them. Very personal, really cares about you as a person, cared about me getting back onto the court, and not just being on the court, but being able to compete and play at a high level. Explained, what that might look like. And I was, not sure what to expect coming back, but yeah, like I can get back. I'm playing at the highest level I've pretty much ever played at, pain-free, which I haven't said that in probably 15, 20 years. But my knees, I'm playing pain-free, pushing my body to its limits as a professional athlete. So for those that are just trying to come back, being a weekend warrior, whatever your goals are, it's definitely possible. I trusted Dr. D. If I ever have any more issues, hopefully I don't. He's my guy. But yeah, for sure, I'm pushing my body to the extreme. So I know if it's working for me, it can work for you. And I hope you'll at least go and listen and see what the S-Core is all about.
Well, again, really appreciate you putting faith in me and the team. And, for me, I mean, there's sports that I do, but, I sort of go to sleep at night sort of dreaming about the knee and all the different things. I sort of geek out on that and wake up thinking, of new things. But, appreciate, I mean, the implant was designed for high level activity as soon as possible, to fix the sort of the root of the problem, where it's not necessarily that the articular cartilage isn't important, but it's just the bone is as important or more. And existing procedures, I mean, that's what I would do. I did all this training and fellowship training, and then I came out and was doing what I was trained, and I just didn't see the results that I liked. We don't always like to have to take patients back for revision surgery, but I would, to see what the results of my previous surgery were. And I just wasn't that happy. And I knew, the patients, it's not heart surgery we're doing, but the patients would either stop doing what they wanted to do or would just be lost to follow-up, which is, not everybody wants to keep having surgeries if they're not going to, last or whatnot. So, but, it obviously takes faith on both sides, and, for Brooke's knees, I'm always kind of prone to go off on small tangents, but I'll throw this in there as well. But a lot of kneecap patellofemoral problems also coexist with posterolateral instability, which is the lateral side of your knee, because the knee flexes and extends, but it also rotates. So her knees were rotationally loose, which causes the kneecap to shift around. So we were, those diagnoses you can't necessarily see on an MRI, because the ligaments that control the rotation are very thin and flat. They're like a sheet of paper, and they get stretched out, and they're not like a rope, which the MRI could see better. So we were able to do like an advancement of the posterolateral corner just through a little mini incision that I think has also helped make her kneecap more stable, and has helped keep it centered. But anyway, I do appreciate her patience with you know, the whole process of trying to keep her tuned up. We've basically thrown the book at her. We have the shockwave therapy device that we've thrown at her, and I'm a big believer in orthobiologics. We've done, some placental tissue stuff and PRP when she's needed it. So, all these kinds of things to kind of get her to be able to perform at the highest level possible. We can't always give someone the knee they were born with, but we're trying to push as far as we can. So, Tom, what am I missing? Is there some other questions that maybe patients or viewers might want to hear from Brooke?
No, I think this has been great, guys. And Brooke, thank you so much. It's always great to see you and listen to you, and great accomplishments. At Neo, did you have anything else? You're the one who's running this campaign. So what did you have? You other questions for Brooke?
No, I think what you had was great. Yeah, I think that was really good.
Excellent. Well, Brooke, thank you so much. I sent you a text and thanking you as well. So I really appreciate it. And good luck with it. When's the next tournament?
We're going to Denver, July 6th.
Okay.
Yeah.
And I asked you about the Manhattan Beach date.
Manhattan is middle of August.
Okay. All right. Well, we'll
maybe.
be down there. We'll get it organized. But just send me the date when you know what it is, because we'll come down and have a rooting session or section for you.
That'd be awesome.
All right. Hey, thank you again.
Thanks so much, Brooke.
Happy to do this whenever you guys need me.
Oh, that's awesome.
Yeah.
Say hi to Nick for us.
Okay, I will.
All right. Thank you.
Bye.
Bye-bye.
Thanks, Brooke.